Hello, good morning, good afternoon, and good evening. Welcome, everyone. Thank you for joining us today for this Path Live forum, where we're going to be discussing connected diagnostics. Do the benefits outweigh the costs? My name is Dickie Settle. I'm Path's Chief Digital Officer at Path. I'm delighted to be moderating today's conversation. As you see, I'm going to be walking through the conversation because this is going to be quite a journey as we explore and learn together this new and important emerging area, rather literally on the edges of global digital health and exploring the future of diagnostics in the digital age. Let's start by going over a few logistics. We want to hear from you all during this conversation, so please share your questions and comments with us by submitting in the Q&A box at any time throughout the discussion. We'll be monitoring your questions and we'll save some time at the end for Q&A. This call is being recorded and will be distributed to those unable to attend. I see that we have participants joining us from all over the world. See government representatives, community organizations and NGOs, donors, as well as private sector partners and others. Thank you so much for joining us. Before I introduce our panelists and dive into a facilitated discussion, I'd like to provide a brief overview of connected diagnostics. One of the reasons we're so excited to kick off this conversation today is because this space is still so new and continuously evolving. Bringing together the amazing audience and speakers can help us connect across the diagnostics ecosystem to acknowledge various challenges and opportunities and begin an ongoing discussion on connected diagnostics. As a still nascent space, even the term connected diagnostics is not yet universally used. Path's working definition of connected diagnostics are diagnostic systems that are digitalized to adapt and integrate with the broader healthcare ecosystem in order to improve the accuracy, efficiency, and accessibility of medical diagnostic technologies and data. Traditional or disconnected diagnostics, if you will, present many potential limits to care that range from subjective interpretation of rapid diagnostic tests or RDTs to failures in information transfer between lab-based diagnostics and providers and patients. Many traditional diagnostics also typically require a provider to administer and interpret the results. Connected diagnostics help close these gaps. So examples of connected diagnostics include approaches as simple as linking a manual RDT with a mobile phone-based results validation and communication tool, as we all saw with many home-based COVID tests during the pandemic. More sophisticated examples include using a smartphone-based reader to improve objective results of an RDT, equipping health workers with more sophisticated handheld diagnostic devices with built-in digital capabilities, onboard data, and connectivity, lab information management systems, surveillance lab networks, as well as wearables and connected home tests and diagnostic technologies that are being developed every day. In coming to Path, I was so excited to learn about the rather unique diagnostics work for global health equity that the organization does. And conversations on the power of bringing digital and diagnostics together began almost from my very first day. At Path, connected diagnostics, this fusion of the digital and diagnostic space, is recognized as a key component of global health and the work we do. Current projects include a wonderful partnership with FIND, who's been a great thought partner with us in exploring and developing this space. We've been partnering to enable development of common data models and exchange formats to enable COVID RDT incorporation into leading mobile health tools in LMICs. We've been working alongside digital health developers to develop digital reader solutions to accompany RDTs as part of a complete solution for polio eradication efforts in our PID project. We've been developing data repositories to support digital health developers across vetted diagnostic data sets in our diagnostics image repository. And we've been supporting countries and ministries of health to establish digital health strategies and roadmaps that incorporate enterprise architectures that embrace how connected diagnostics fit into the greater whole of the health system. This is an approach pioneered by the Tanzania Data Use Partnership and is now being supported and scaled in many countries through Path's Global Digital Square initiative. So for a long time, digital technologies have been applied in a fragmented way, which has created challenges for ensuring they contribute to health system strengthening for health equity. Digital technologies are no longer simply an enhancement of health services, nice to have, but are a fundamental element to health systems. Digital tools and approaches do enhance all aspects of global health, so we must take a holistic, systemic view of their use and development. Coupled with the fact that the lack of diagnostics also represents the largest gap in patient care today, according to the 2021 Lancet Commission on Diagnostics, the need for connected diagnostics as a key area of focus emerges. Diagnostic tools and technologies often provide the most objective and quantitative data on a patient, yet so much error happens between the subjective reading of diagnostic tests and the manual recording and tallying of results, for example. Use of connected diagnostics in global health allows for improved data collection, reporting, and clinical care facilitation, while also enabling further democratization of health services to support care and increase equity. Considering the broad scope of connected diagnostics, the ecosystem of stakeholders is complex, including healthcare workers, digital health developers, governance organizations, diagnostic developers, ministries of health and other government actors, community, and patients. And all of these perspectives need to be brought to bear in developing a connected diagnostic strategy and approach. At PATH, we believe it is the involvement of the countries and communities that bring the greatest value to the health of their people, to reimagine and realize what health in the digital age can and should look like. As with any area with a new and substantial impact, it's important to consider various factors of connected diagnostics. So just a few examples below. The opportunities that connected diagnostics offer include democratization of healthcare system and services, engagement and empowerment of patients to be active participants in their own care, the streamlining of healthcare worker efforts as we see more efficient exchange of diagnostic tests and results moving back and forth between healthcare workers and labs, increasing the quality of healthcare services, such as the adherence to guidelines and ensuring consistency and quality of care, and improving that quality, visibility, and access to data, which can unlock potential for analytics and decision support services for various applications, such as optimization of clinical care processes, procurement and demand forecasting, outbreak response strategy, and on and on. While areas that remain unknown or have known risks are going to be very important in our discussion. And so many of these health data concerns are broader than connected diagnostics, but apply very much to any individual health data. These include, of course, data quality, timeliness, accuracy, completeness, and availability of that data. The privacy and security risks are so important and such a challenge right now, involved in the management and storage of individually identifiable health data, and the transparency and advocacy around these privacy and security risks are so critical to create increase in trust and continue building towards true equity. Bias as a result of health data used to train and develop machine learning models. We've been learning more and more about the way that AI and machine learning models are trained, and they're rarely trained on the populations that we were really seeking to support. Limited infrastructure, including the technical infrastructure, the larger data infrastructure, national and global policy, the enabling policy environment, and digital literacy and other capacities within a country to support an ecosystem of connected diagnostics. There's a lack of ongoing monitoring and evaluation for connected diagnostics to really help capture the value and the quality of the use and deployments that are already in place. There's a need for sustainable investment and long-term financing, and appropriate development and use of connected diagnosis will require a holistic and systematic approach to address these challenges and realize these opportunities in a way that ensures access to high quality, affordable, and accessible connected diagnostics. On that note, we are honored to be joined today by an esteemed panel of digital health advisors, leaders, and implementers who have agreed to help us navigate the discussion on the costs and benefits of connected diagnostics. Joining us today is Adele Wagaman, Senior Digital Health Advisor, USAID. Hi, Adele. Dr. Ayob Manya from the Department of Monitoring and Evaluation and Health Informatics at the Ministry of Health in Kenya. Welcome, Dr. Ayob. John Fairhurst, the Head of Private Sector Engagement at the Global Fund. Welcome, John. And Dr. Tuan Nguyen, from the Department of Epidemiology at the National Institute of Hygiene and Epidemiology in Vietnam. Welcome, Dr. Tuan. Thank you all for being with us today. We so appreciate your time and wisdom in our conversation. So we're going to begin our facilitated discussion now. It's going to be split into two rounds. In this round, we will explore perspectives on connected diagnostics. And so for round one, in understanding these connected diagnostics, I'm going to start with Dr. Tuan. Dr. Tuan, the Ministry of Health in Vietnam uses a COVID-19 dashboard informed through digital systems that capture diagnostic data. What are some of the benefits and challenges that you've observed from this work? Are there other areas or applications you think could benefit from a similar connected approach?
Yeah, thank you very much for your question. Actually, in Vietnam, we started the Ministry of Health database and dashboards 1.5 years after the beginning of the pandemic, and we benefit a lot from the system. So we can know the daily number of deaths, the number of cases, and number of recoveries, and we can see it for every province in Vietnam, and we can see the dynamic of the pandemic, and we can see them to manage the field hospital and to organize the human resources, and also to make the policy for the response to the pandemic. And I think it's very nice, and it's powered by the Ministry of Health and the Department of Preventive Medicine. And NIHA is one of the key stakeholder of this system, and we use a lot in the prevention and management of the outbreak in the field, in the community, and we support also the field hospital, and we also provides technical advice to Ministry of Health and provincial CDC network in Vietnam. And I think we see a lot of dashboard, we see a lot of data, and we see the dynamic of the case by the risk assessment from this database. And I think this is a lot of benefits, but we also have challenges using this system. For example, data is not all the way updated or not all the way real time, and we have a lot of how to say the get back delay updated number of cases. So at that time, several thousand of cases come on the system. And we have a search of the updated, and sometimes it affects the real risk assessment. And also we have a challenge in connected in reporting from the laboratory, because the public health system notify the case for the identification of case from the government. But in the laboratory, we have other system to manage the number of cases. Sometimes that's directly supported the response in the province, but not go to the national level. And also the national level is not open to the world. And I mean, we not easily share this database to the global system. So it's a little bit difficult. And at the beginning, the system is not so stable. And maybe 2 years later, and recently, it's very stable. Yes. So far, what I have to say. Thank you.
Thank you very much, Dr. Tuan. This is really just a model that you've developed here in Vietnam, and it's really exciting to hear you speak directly from the experiences and the opportunities that it represents. I'm going to turn now to Dr. Ayub from the Ministry of Health in Kenya. Dr. Ayub, you've pushed to promote data demand and use, a culture really of increased data demand and use in Kenya for global health, public health decisions and action through your entire career. How do you see connected diagnostics as part of this vision? Any specific examples you would like to highlight?
Yeah, thank you for the question. I would like just to say most of the work I've been doing on health information systems. And one of the most researched aspects of routine health information system in low-income countries is the constrained data demand and use for public health decision making. Most researchers cite poor data quality as one of the main reasons for this. And data quality is complex, but most people describe it using the following attributes. That's accuracy, timeliness, and completeness. When the data are thought to be of poor quality, policymakers fail to utilize them, hence the reduced demand. So the use of connected diagnostic tools has the potential to improve the data quality by providing accurate, complete, and real-time data. So apart from improving data quality, connected diagnostics can support health workers in making clinical decisions from the results. Most of these diagnostics incorporate the ranges of the values to support clinical diagnosis. For example, they can tell you if the HB is 10, then they'll tell you the lower value is 8 and the higher value is 12. And so the clinician can know that I am within the normal range. And this actually improves the use of data since interpretations can be achieved quickly, affording the use of the data. In countries where clients pay for health services, connected diagnostics can improve revenue collection efficiency by being connected to payment systems. For example, the mobile money. In Kenya, we have the M-Pesa. This can motivate policymakers to invest in these tools, partially addressing the sustainability challenges. In addition, these tools can be linked to other systems that can generate interactive dashboards that can be used by policymakers. So if you connect them to other systems, other people can be able to see and can also support in the sharing of information across board. And it can actually improve the management of the patient care because of the support we can receive from external sources. But so in conclusion, I would just want to say that coupled with good management, connected diagnostics can dramatically improve demand and the use of data for informed decisions. Thank you.
Fantastic. Thank you, Dr. Ayub. What a great, I love the specificity of your example in really explaining how the connected diagnostics can help address data quality issues, which of course will drive that ideally virtuous cycle of data demand. The higher quality the data, the more trusted the data, the more the demand for data, which in turn we hope will lead to further improvements in quality. So thank you very much for speaking to that. Now, I'm going to turn to Adele Wagaman, a Senior Digital Health Advisor at USAID. And Adele, coming to the kind of critical investor and influencer level, from your experience working at USAID in digital health, you've had a front row seat to observing and influencing many evolving digital health investment approaches. Recognizing that the role and opportunity of connected diagnostics is an emerging topic over the last several years, do you see a need for greater emphasis on investing in these technologies and incorporating them into national digital health strategies, roadmaps, and architectures?
Yeah, thanks, Dicky. Thanks for the opportunity to be part of this panel, part of the learning journey of this discussion about connected diagnostics and digital health more broadly, and the broader learning journey that we're on together as this field continues to rapidly evolve. So I think it's useful to take a step back and reflect on the juncture that we're at right now in global health history, on the heels of the first decline in global life expectancy since World War II. Of course, I'm talking about the COVID-19 pandemic, which has had far-reaching impacts on health systems and health outcomes, both through primary and secondary impacts around the world. And one of the ways that USAID is tackling this challenge is through a renewed focus on primary health care. And of course, I'm biased here because I think about digital technologies as part of health all the time. But I really do believe strongly that digital technologies, including connected diagnostics, is a really critical part of how we're going to be able to deliver on the promise of resilient primary health care. We've heard a lot of the other speakers talk about data, and that's really, to me, one of the most important aspects of the potential of digital technologies. It's to gather and analyze, manage and exchange data and information in all areas of health and bringing them together as one to be able to strengthen integrated patient healthcare across different health verticals and over time. So we see there's really tremendous potential, but we also know from the past 15 years plus of investments in this space that we can't focus on the digital technologies alone. That if we want these digital technologies and the data that they enable to really deliver on their full potential, we have to invest in the broader enabling environment in which these technologies work. That's something we've thought a lot about at USAID. We have our own USAID Digital Health Vision, which charts out a change management journey for us as USAID around how we make our investments in digital technologies and data systems, including connected diagnostics, and how we can best partner with countries to support their own change management journey around digital technologies. So we think this planning at the national level, like you mentioned in your question, such as through national digital health strategies, roadmaps, architecture, is really critical to enabling the interoperability of data and the kind of on-ramp to data sharing that we need in order to improve delivery of healthcare at scale, whether that's at the community level, at the national level, or even, as one of the speakers mentioned earlier, the importance of being able to connect up to the global level, especially around topics like disease surveillance and reporting. And if we have more time during the second question, I'll dig in a little bit further. Thanks, over to you.
Great, thanks, Adele. Actually, let's do a quick follow-up. As you've been looking across, I thought you spoke really, really well to the links and nature of connected diagnostics integrating with primary healthcare and integrated care, right? That they're thinking about that comprehensive, holistic approach. Speaking again as an advisor to the largest investor in global health, what would you like to see more of?
So I think, across different sectors, when you look at digital innovation, it really does move so quickly and often outpaces the policy and regulatory environments that govern their use. And so a constant refrain, I think, for us in this community has been to remember that technology sometimes, despite its complexity, can be the easy part. And that we really need to be looking at things like, going back to the WHO ITU eHealth building blocks, the infrastructure. So what is the quality and reach of the digital connectivity that enables us to be using these devices in a variety of places to meet the needs wherever they are? What can we do to be thinking about how we make that infrastructure as extended and robust as possible? From a policy and regulatory environment, what are we doing to ensure that there are the appropriate safeguards in place governing the way that the data is accessed and used and supporting the way that these systems are built and designed and implemented? And then also, importantly, in the institutional and workforce capacity, digital is not a just add water type scenario. It's not just changing the format in which data is collected and shared. It generates tremendous new needs around capacity building, around processes and policies at the institutional level, workflows at the individual health worker level. And we need to be thinking about how we support countries and communities and health workers through this transformation journey so that we're able to pick up and leverage these tools to really deliver on their full potential. So I think it's thinking about that broader enabling environment for digital technologies and how we are considering that at the same time that we're making these investments into the technology tools themselves.
Fantastic, thank you, Adele. I love the way you brought in the WHO ITU eHealth building blocks. It's really helping to frame the enabling environment we have to keep in mind. It's important to remember this is not a matter of just deploying a new technology or tool. It's about thinking about the entire environment around it and how that tool is going to impact and change how health is delivered. So thank you, great highlights. So next, John Fairhurst at the Global Fund. I'm really excited you could join us as the head of private sector engagement for the fund. And we really, of course, in anything digital, pay such close attention to private sector as the source of so much innovation and so much change and so much impact on our lives. And so the private sector in connected diagnostics plays a fundamental role in the development and implementations of these technologies and associated digital tools. What are elements from your perspective to consider for strong collaboration with the private sector and other key actors in the connected diagnostics ecosystem? And do you have examples of impact made possible when these are realized?
So thanks, Dickie, and real pleasure to be here with the other speakers. So, I mean, I think in a way, I can pick up a lot from where Adele sort of finished, and the other speakers too. You know, the context I think we work in, you know, as you outlined, is that this is a broad ecosystem. When we think about connected diagnostics, it covers, you know, a massive range of possible use cases, from sort of mobile phones, you know, mobile phone readers, all the way through to sophisticated, you know, communications equipment in labs and sort of tertiary care settings. You know, I think when you look at that ecosystem, the private sector plays a part across all parts of it, really, whether it's in the connectivity ecosystem around mobile phones, or the development of equipment that includes connectivity or diagnostic tests, or the analytics and the tools that allow us to develop analysis. So, you know, I think, you know, the reason that I start with that is I think the first part of making a fantastic collaboration is clarity. It's very much about understanding which piece of that ecosystem are you really looking to develop? And I think it's really crucial, and many of the previous speakers have framed this, that, you know, we're very much driven by impact, not by how cool technology is, that we're driven by actually understanding how the technology solves a fundamental problem in health, whether it's speeding up access to information, or it's providing more detailed information, or it's providing better analytics of multi-source information. So I think that clarity is really important, particularly when we have such a complex ecosystem of engagement. The second thing in this is obvious in the question, really, is collaboration. And I think what's key there is that we're making sure that this isn't just a bilateral conversation, that we need many parties sitting at a table to design these solutions. And you outlined again in your analysis some of the risks here around, you know, new information and more rapid provision of information in terms of who, you know, privacy, security, all of these kinds of things, which are really critical. So that collaboration, I think, is really critical, that it brings in, you know, the multiple parties who have an interest in not only how this is designed, but how it's implemented is effective. And that leads me to the next one, which is about communities. And, you know, this is, I think, a fundamental principle of design of anything, really, is that you're involving the people that are affected by this in that conversation. And I think that engagement with communities with the private sector is really central. You know, private sector would call it customer driven. We in development would call it involving communities, but it's the same principle of understanding the users as well too. And then the last two, I think, just quickly, one is one Adele just referenced, which is, you know, very much of this is about bringing new cool technology. If you don't bring capacity with it, it will ultimately really struggle to go to scale, I think. So the capacity for this to be locally owned, excuse me, locally built, but very critically locally implemented, I think is really central. So there has to be a piece of building the local capacity to use and even build diagnostics and the use of technology. And the last one, and I've tried to give it all begin with C, as you may have gathered already. It's money. So I called that sense because I couldn't think of a C for money that easily. But obviously money is important. And so to your question about examples, we've at the Global Fund have done a number of what we call catalytic initiatives, catalytic funds, which are driven by this combination of money and technical capability. And we've seen some fantastic success in building some of these tools, particularly with community health workers. and very much working from the last mile to enable community health workers to collect information more efficiently and to bring that information in a connected way into health information systems. So that's been, I think, fundamentally transformational as well. So thank you.
Fantastic, John. Thank you. I very much appreciate your call to action your calls to action, really, for clarity, for collaboration, and for being catalytic in connected diagnostics. And that's not just my love for alliteration. Thank you. It's fantastic. All right. Let's move to our second round now. And John, if you don't mind if we stay with you, from your experience working with private sector partners at the Global Fund, what are some of the key gaps and questions that still need to be addressed to allow for sustainable development and implementation of connected diagnostics and their underlying business models for global health?
Yeah, so thank you. I mean, obviously, it's a big question. I think the first one, going back to what I said, is vision. And I think it's really critical that we have a clear strategy that integrates, the role of connected diagnostics into a broader ecosystem. We also, I think that vision, the complexity that we see is that information now is much broader than health information. It involves weather, and that's becoming an increasingly critical part of looking at diagnostics and looking at how health is moving. So I think that vision for this sort of multi-source access to information is really important. And that leads to the second piece, which is, I think, well, we all want faster, more relevant, more accurate information. The growth and the volume of information is something that needs analytics. It needs the ability to crunch that data into something that is really useful. And so it's really important that we have that analytics capacity, both in terms of the tools. Obviously, AI is particularly sort of, trendy to talk about at the moment, but even beyond AI, the ability to turn information into actionable response, I think, is really critical. So that analytics capacity needs to be built in comparison with that as well. And of course, that links to an overarching piece around governance and understanding how data is being governed, how it's being sourced, how it's being managed. And both of those two, I think, link to having the sort of capacities to build information. To some extent, I think the question is less about the ability to build connected diagnostics to increase information flows. It's as much about the ability to process that and turn it into something which is particularly useful as well. And then at a more technical level, and something again you referenced earlier on, there is a bucket of information out there in the world. Much of it is in silos and not brought together in an effective way. And I think we need to be really clear as we're building this new information flow that we have interoperability built in, that information between systems is much more shareable and accessible, because the power is in bringing two pieces of information or three pieces of information together. That's what allows us to be smarter in making decisions. So I think that interoperability is really central as well. So there are many other things, but I think those things are really critical for our success.
Thank you again, John. That was a lot in a short time. So speaking to the importance of capacity, speaking to the importance of analytics, recognizing connected diagnostics really are at the collection point. But if we don't ensure and support the capacities to really process that data and convert it into actionable information and decisions, then those investments are going to go for naught. So thinking about that entire continuum, the enabling environment, as Adele spoke to, the interoperability, every aspect of your answer really encourages us not to break out connected diagnostics as a separate thing, but to think of it as part of an integrated holistic whole. So thank you for those comments. Shifting now to Adele. In your experience with USAID, what lessons learned in the digital health space can be leveraged as we look to more specifically invest in connected diagnostics?
Sorry, I've been trouble getting off mute there for a second. Yeah, I think, we've learned a lot of important lessons and taken steps to document these in public ways, starting with the principles for digital development and then interpreting those for guidance for the funders of the health sector, and build a new set of principles called the digital investment principles. And if people haven't seen those, I encourage you to go take a look because they are directly relevant to this conversation. And a couple of lessons that I'll highlight. One, during the West Africa Ebola outbreak, and now again, as part of our COVID-19 response, we're taking a dedicated learning approach to looking at what's working, but also what's not working. Because we know the threat of pandemics, global health shocks is not going away. If anything, we need to be doubling down on how we increase our resilience. And technologies, digital technologies, connected diagnostics have an important role to play here. One of the things we need to be mindful of is, as John was saying, making sure that as we invest in and use these devices, we're keeping the end state in mind, which is improved access to equity of, quality of healthcare for the people who need it, when and where they need it. And in order to get there, we need to ensure that we're taking a standards-based approach with the systems that we invest in to enable that data to be exchanged and used to support a variety of decisions at all levels of the health system, from the individual to the frontline health worker, up to health systems managers and national government stakeholders. So that's really critical. And I think that we're seeing a big move toward, we've talked about software global goods. There's a broader movement toward digital public infrastructure, digital public goods. And so we need to be asking ourselves, as we look at this evolving facet of the digital health domain in connected diagnostics, how do we apply that learning of taking an open source, wherever possible, global goods type approach to connected diagnostics, recognizing that there are a variety of stakeholders in the mix around connected diagnostics, and thinking about how we can structure our investments in a way to most be sustainable and able to be effectively managed and sustained at the national level. So I think that's one, looking at how we can structure these investments in a way that they are sustainable, and that they can be managed effectively by the governments where these tools are used, not only at the point of care, but also in thinking about how the data from these systems support the broader health system on an ongoing basis.
Thank you very much for that answer, Adele. I see a number of thumbs up and applauses coming on your remarks on sustainability. And I think that is absolutely what we've been touching on as we think about that enabling environment. We don't want to be making the kinds of technical investments that just wind up in closets and not used to really bring value and impact to the health system and to those that they serve. And following up on that important concept of sustainability, Dr. Ayub, I wanted to explore your perspective from the Ministry of Health in Kenya. In your opinion, what would a sustainable model, to Adele's point, for data use for public health decisions and action look like in Kenya? And what role could connected diagnostics play in achieving that?
I like your question. I just want to start by saying that when we think of advanced technologies, there are normally two things that come to our mind. Number one is the acquisition of the technology, meaning buying the technologies. And the second one is actually the training of the people who are going to use this technology. So to afford adoption of these advanced diagnostic tools, there should be a demonstration of efficiency, which is usually checked by saving lives, saving practitioners' time, and cost effectiveness. So in simple words, the tools should be affordable, safe, and easy to use. For me, adoption of this, I would just want to ask a few questions that we need to ask ourselves before we actually move. The first important thing, especially for some of us in the low to middle income countries, is how easily can the tool be sourced. So some things are good, but they may not be really easy to get. So these are some of the areas that we need to really address. The other question that is very important is, how about the after-sales services? For example, repairs and refilling. Sometimes actually the cost of the gadget might be easy, but the material to refill it is very expensive and not sustainable. We've had a lot of tools coming to Africa in our country that just lie there because we don't have some, the requirements are not there, and the after sales are not good. And so you get problems. You are left with a very useful gadget, but it doesn't work. The other thing is about safety. I mean, some of these new gadgets maybe have not been taken through the safety issues. People might suffer from contacts. And so those are some of the areas that we need to think about. And of great importance is the quality control. Is there a team that can check whether what is being shown is the right one? Because some of the data, there could be false positives, false negatives, and that can actually alarm somebody. You might use it to show something that is not actually available in the body of the human being, go there and find it is not there. So there are all those areas of quality control that we have to be very careful. And I've seen it in our country where we can't even interpret what is appearing on some of these diagnostics. And the last and very important question is we need to ask ourselves, are some of these tests really necessary? So the need for the clinician to understand the client is very paramount. The clinician should not just be treating the tests as they appear, and because they may just be responding to results that are not there. For example, a clinician may find something wrong in the body, but that was not the aim of the patient. So you end up deviating from the main complaint. So all these aspects, if you are able to answer some of them, they would actually lead up to issues of affordability. And if we can afford to restock some of the issues, then we'll be able to apply them clearly. So to me, I look at that as a very important aspect in terms of being able to utilize the gadgets, being able to train people, and actually finally being able to repair in case they get spoiled. So that is, to me, what I've been looking, the type of gadgets that I would look for our developing world. Over.
Thank you, Dr. Ayub. That was excellent. Such concrete and specific examples from your experience in Kenya to really encourage us to consider some of the sustainability and cost factors associated with these connected diagnostics, but also how they fit into the care paradigm and how the tests are selected and used during the care services in order to really ensure that we're maximizing the value and minimizing the cost in these technologies and their support to the health system. Moving further east, and Dr. Tuan, thank you again for joining us so late in Vietnam. We've discussed quite the emergent continuum. You're going to wrap us up here for the panel in this discussion of this emergent continuum from health worker diagnostics to lab-based diagnostics, and you bring that larger connection to national health surveillance. And your COVID-19 case dashboard speaks to the analytics capacity and applications that John and Dr. Ayub spoke to. What are some of the lessons learned from your experiences establishing a COVID-19 case dashboard in Vietnam that you could share with other countries looking to invest in similar systems?
Very nice. Thank you very much for your remark. And I just want to share some more thing. In Vietnam, we produce a lot of data, you know, but we really need very good data, and we also need to be able to use that data efficiently. For example, for further analysis and integrated for the forecasting and AI and machine learning. You know, in Vietnam, we have a lot of technology solutions, and also we have a lot of software. But it seemed to me, in my opinion, is they are so fragmented, and there are lots of low quality data and incomplete. So it's really difficult to use. Even we have a very good modeling and very good forecasting model, and also we face a lot of forecasting issue. We cannot predict very well because we don't have very good quality data, and also we have not a real-time data. And I think the connected diagnostic is a really good technology solution to be integrated into the digital transformation in Vietnam. And now we try to build the e-government at a very high speed, and I think in the next 10 years we need a really overall approach to speed up our digital government. And of course, connected diagnostic is a really nice approach to connected many stakeholders, community, patient, care worker, developer, government, and Ministry of Health and preventive medicine network, and everything. We need that a lot, and so far we try to find a good solution to try a good integration, and I think we also need to work with the international expert to have a good idea how to integrate it and how to implement it, that idea further in Vietnam situation. I think we need the technology, we need the information that support us to fight the pandemic, to not only COVID-19 but many other communicable diseases in Vietnam. The government actually now is running the nationwide surveillance system according to regulated by the Circular 54, and it's really very nice data. We collect all kind of disease, more than 40 diseases, communicable diseases in Vietnam, and most of the data, we have a lot of data, but most of them, I think we have a limitation on the quality of data, and also the real-time data and exhaustive use of data, and new method to use, for example, capability to analyze that data, also really nice. And now I think if we have integrated and environment or connected environment, we can benefit a lot of that. We can benefit for the society, benefits for the policymaker, benefits for the patient, and we can manage better healthcare system.
Thank you, Dr. Tuan. That was a that was a fantastic summary. Roll up of the panel, all of the themes that we've been bringing to bear on connected diagnostics and its space in the larger global health ecosystem, as well as the emerging transformation of that ecosystem as global health moves into the digital age at the country, at the regional, at the global levels. We are all seeking to bring these connections together for better strength, value, and equity around the world. Let's go to some questions from the audience. We have had quite a few coming in. I'm seeing such great audience responses to our panelists. John, the first question goes to you. Could you please enlighten us and our audience on how communities can benefit from connected diagnostics, especially where digitalization is very limited? For example, when there's a lack of data related to humans, households, etc.
Sorry, excuse me. Well, I don't know if I can enlighten you, but I think it's one of the most critical questions. You know, in the sense of we all recognise that a lot of the burden of disease is in the sort of last mile, and they have often, by definition, the places which have the least access and connectivity. So I think, in a way, the question is about how do we bring the connectivity, how do we bring the access to these sort of rapid information flow diagnostics to people. the example that is probably the most obvious to the Global Fund is that there's something like 2 billion fevers in Africa every year, and about 40% of those go undiagnosed. And a big chunk of them, 50 to 60%, are diagnosed at first in the private sector, or even in the public health system. Now, one of the key pieces of technology, obviously, is providing things like readers to people to enable them not only to read the tests more effectively, but to provide a more intelligent diagnosis across the spectrum. So whether it's malaria or pneumonia or even COVID, is really critical. So I think bringing that kind of technology to the point of care, not just in the public sector, but also the private sector, obviously with community health workers, is certainly one way that we can bring a sort of connected diagnostic agenda to the people that I think really need it most, as well. Beyond that, the ecosystem of building out connectivity and providing the ability for more people to be connected, which we all know has multiple impacts on not just health, but economies, is critical too, as well. But I think we have to give the sort of frontline engagers these connected diagnostics, even at the simple level of mobile readers, but also obviously more sophisticated point of care machines too. So hopefully that helps.
Excellent. Thank you very much, John. So this next question, Adele, you spoke about the global digital health principles or the digital development principles. And one of those principles speaks so strongly, in fact, several speak so strongly to the importance of being open and collaborative. And in the connected diagnostic space, it's very important, we believe, to have open source code for the devices so they can be connected with system-specific information systems. What can be measures to help encourage this?
So I think it's fantastic to be reflecting on this question and tying it back to what we've been learning from the digital health landscape overall. We've done a lot of work, including in partnership with Path and Digital Square, to set out a maturity model to take a uniform approach to how we assess the maturity of software global goods. And I think we could extend that into the connected diagnostic space and ask ourselves, are the questions we're asking, including around openness, do they relay to connected diagnostics, or are there features of this particular domain of digital health that require us to ask additional questions or to further nuance the questions that we're asking? And to take that approach to the connected diagnostic space to make sure that as we are investing in these tools, which really are so critical, especially in the context of disease outbreaks, really extending our eyes and ears in the field to understand where there are acute healthcare needs we need to prioritize rapidly to address, that we are investing in these tools in a way that do enable them to be interoperable, because that is the point. The point is that we get the access to the data we need about the individual, but we create the data in such a way that is shareable, so that if what is happening is a new acute disease outbreak, that data can be rapidly shared to enable an effective response. And so thinking about how we measure that openness is critical, and I think we've got some of the right tools already in place to adapt and use.
Wonderful. Thank you very much, Adele. Dr. Ayab, if I might put the next question to you, a major challenge that we have in all contexts, not just LMICs, is connectedness of the data sets and the databases. The information systems are so very disintegrated, especially at the primary healthcare level. I'd love to invite you to speak to some possible approaches to really help move from our current challenge of fragmentation to greater data integration that will hopefully really help us realize this vision of connected diagnostics.
Yeah, thank you for that question. And you've just been speaking my mind, because we know that most of the problems we address in our health information systems, they actually talk of them being very many parallel systems who are not connected. But what we think the best way out of this is that we are seeing quite a lot of application of technology and internet connectivity going to very, very far places in most countries. At least the central level or the other bigger towns, they tend to have enough internet. And a lot of countries are also coming up with what we call a central database that can be able to handle. The only hurdle we've been getting is normally the disease-based parallel system that address a particular need, like the HIV/AIDS, like the immunization, that tend to get support, especially from implementing partners. But the reason this come up is because the countries normally lack a centralized system. So to me, I would push on countries to take up the new technological way of internet and the other things that to come up with systems that can speak to each other. And we only don't just require the system to be integrated as one big system, but we can actually use the various approaches that we have for interoperability. You can use various standards that can allow sharing of data from one system to the other. And finally, to me, since some of these connected diagnostics also tend to be within the local, maybe the local hospital, we can actually manage to have an intranet working within the same hospital also, so that you can actually get a dashboard showing how many tests are waiting to be tested, what is happening, so that actually locally you are able to utilize the information within before you start actually thinking of sharing beyond the local area network. So to me, that's what I would say. Think big, utilize the new technology, and if there is a problem, think of even doing certain things in offline. Although I'm not an expert in IT, but I'm sure there's a way of making some ways such that when you are offline and when you reach internet, you're able to connect some of these things. I think I would like to leave it at that. Over.
Fantastic. Thank you, Dr. Ayad. Very well answered. All right, we are down to our last 5 minutes. We're almost at the end of the hour. And I'd really like to close our conversation with each speaker sharing in one sentence on what you see as the prerequisites for a successful and sustainable business model for connected diagnostics. And Dr. Tuan, let's start with you.
So I think the connected diagnostic model is very promising and very helpful. I think in Vietnam, we also need to integrate this system in the lower level, I mean the primary healthcare system. At that level, we need a lot of training, we need infrastructure, and we need more human resources. Thank you.
Thank you, Dr. Tuan. All right, let's turn to John. The prerequisites for a successful and sustainable connected diagnostics business model.
Well, three things. I mean, one, I think, as any good private sector organization would do, is to start with your customer, and to make sure that you understand that you're solving a need that is real for people and not real for people that are based in Geneva or in Washington or anywhere else. So I think that is fundamental. If you start with the customer, you will start and build a solution that can scale effectively. I think the second thing is understanding who you need to be in the room to build a business model that goes beyond an individual space. So there are organizations like the Global Fund, like USAID, who are not only investing in solutions, they also make markets for solutions to be successful. So understanding and working with that group of organizations is really central. And then the last thing is obviously having a cool technology and having something which is differentiated. And while I absolutely believe that open source is a fundamental building block for us to be successful, I think we all recognize that you need to have a level of intellectual property to make a business model that is also successful. So finding the balance between those two things is really central, I think, to success.
Fantastic. And thank you again for getting another call out for the importance of open source to really help facilitate and encourage. And I would add to that open standards to really help encourage the kinds of interoperability and data exchange that's going to be so important for connected diagnostics to contribute well to care and equity. Okay, so next up, let's see, Adele. What are your thoughts and perspectives? It gets a little harder each time, doesn't it?
Yeah, well, I see the time, so I'm going to be concise, and that is a comprehensive understanding of the use case, both who is using the connected diagnostic and who needs access to the data, and what all of the corollary investments are that are required to support that entire pathway.
That was indeed concise and very specific and clear. All right, last words from our panel, Dr. Ayeb, sum us up. Prerequisites for that successful and sustainable connected diagnostics business model.
I was looking at two areas. One is that I suggest that we need to be able to solve some of the challenges I raised about poor data governance, inadequate infrastructure, and human resources. And generally, while most of these are technical issues, which can actually be supported by technical solutions like programming and everything, some of them are linked to organizational and behavioral factors. For instance, the data decision makers and problem solving behavior, which can heavily influence the ultimate use of these tools, needs to be addressed. So we actually need to train people, change management, so that they can actually accept and finally invest in some of these tools. So technology may be perfect, but the human resources surrounding there may have a problem. So for me, I would just suggest training and having behavioral change mechanisms. Over.
Fantastic. Wow. Thank you, Dr. Ayeb. Those are the perfect last words. And just a big thank you to you, all our wonderful speakers, and to all of you, the audience, for participating in this rich and informative discussion. As the value proposition for connected diagnostics continues to grow and evolve, so will challenges that demand the attention of the global health community. Today's webinar is hopefully just the beginning of many discussions as we further explore and define this space. While there's great potential for connected diagnostics to improve patient and community health, today's presentation made it evident that it will take a multi-sectoral initiative to fully tap this potential. PATH is committed to supporting these efforts and will continue to leverage our knowledge and expertise to implement safe and appropriate diagnostic tools and systems where they are needed most, in partnership with all of our colleagues and leaders around the world. We'd like to invite all of you, donors, academic institutions, private sector, implementation partners, and others, please join us in improving global health by envisioning new ways to deliver healthcare with innovative tools and technologies. Thank you all very much.